We know there can be challenges diagnosing and treating atopic dermatitis in skin of color because it often looks different from white skin with the same condition. In this video, we'll examine how atopic dermatitis presents in both skin of color and white skin and the differences you need to look for to properly diagnose and treat the condition. Clinical features of atopic dermatitis in darker skin types may include some of the following. Erythema, which may be difficult to see. Areas of hypopigmentation. Follicular accentuation. Grayish-white skin discoloration, also known as ashy skin. There is also a higher rate of lesions on the trunk observed in Afro-American patients, and this may make it very difficult to assess the body surface area involvement of atopic dermatitis.
So this is the example of erythema that might be difficult to see. On the left of the screen is an example of white skin. And you can see the erythema or redness on the elbow and on the chest. On the right, which has a darker skin, you will see less of the redness, but more of the violaceous purplish discoloration, both in the arms and the anterior chest.
This slide gives us an example of hypopigmentation in different skin colors. We can see in the top slide white skin moving to brown skin and then black skin. And we can see hypopigmentation is much more pronounced in black skin.
This marked contrast between the white and the black portions of the skin, especially in exposed areas of the body, is more cosmetically challenging for black patients. So follicular accentuation is also more evident in darker skin. If you look closer in the neck of this patient, you will see papules in the neck, which you may miss in white skin or may not be as evident in white skin. This is in a brown-skinned patient. In a darker skin patient, you will see this more obvious, especially in the buttocks of this patient.
This is an example of grayish-white skin discoloration, which can also be called ashy skin. It's also been called that. And in the slide on the left, this is what this can look like in a lighter skin tone. But when we look at the slide on the right, you can see that this is very pronounced. And this can also cause some cosmetic challenges for patients with atopic dermatitis in skin of color.
What you see here is a baby with profound cirrhosis or dryness of the skin, and because of the excessive rubbing and itching, you can see thickening of the skin or lichenification. This is more obvious in a darker skin person. You can also get lichenification in white skinned persons, but it would be less prominent.
There is a higher rate of lesions on the trunk observed in Afro-American patients. In this particular picture, the entire skin, everything that you see, represents involved skin. However, one could miss that the shoulder areas are actually involved skin if you compared them to what you see in the middle and the lower back. In fact, the shoulder areas are involved skin areas. This is what can make assessing the amount of body surface area involved with atopic dermatitis difficult in skin of color.
Prurigo nodularis is also more common in black and brown skin. As you can see here, these nodules occur in any area that the patient can scratch. And because of this trauma of scratching, you see areas of hyperpigmentation and hypopigmentation.
It can be difficult to monitor the effects of topical corticosteroids after prolonged use. In these three slides, we have evidence and pictures of telangiectasia, striae, and atrophy, and what they would look like in white skin. In black skin, telangiectasia and striae may actually blend in with the skin tone and may be very difficult to actually pick up. Atrophy might be a bit easier to see, but nonetheless might be missed.
So what we have shown you are morphologic or physical differences between dark skin and light skin, but there are other social and ethnic differences. Studies have shown that the Black compared to Caucasian or white children in the United States have a higher prevalence of atopic dermatitis. They have an increased persistence of atopic dermatitis from childhood to adulthood. They tend to have more severe atopic dermatitis, and they have more sleep impairment or impairment of the quality of life. Black and Hispanics have also been shown by studies compared to Caucasian children with atopic dermatitis have a lower household income, are more likely to be uninsured or underinsured, and report insufficient time during the patient-physician encounter. Black children and adults with atopic dermatitis are less likely to have an ambulatory visit for atopic dermatitis and or more likely to have an emergency room visit, an urgent care visit, or be hospitalized for their eczema. Lower income and lack of private insurance alone do not account for all of the racial and ethnic disparities observed in atopic dermatitis. So as you can see, diagnosing atopic dermatitis, especially in skin of color, is challenging. We hope the information we've presented helps you provide your patients with the highest level of care. Both the American College of Allergy, Asthma, and Immunology and the Allergy and Asthma Network shares the goal of creating greater understanding surrounding allergic skin diseases for both patients and practitioners. Thank you all for joining us today.